Could you please introduce yourself?
My name is Capitán. I am director of FACIALTEAM, one of the surgeons of the group.
How long have you been using PIEZOSURGERY for?
We started using PIEZOSURGERY, I think, 2010. Since then, we have been introducing more and more tips and inserts, and nowadays it is a fundamental part of our tools.
What made you change from traditional rotating and oscillating tools to PIEZOSURGERY?
This is kind of funny because it was for a very specific patient that we suffered a lot with a surgery trying to remove the gonial angles. So then we decided even to stop doing this procedure because it was very, very difficult to guarantee a predictable outcome. And then we discussed between the two of us, Daniel and me, and then we said, why not trying PIEZOSURGERY? Because they say it's a safe and predictable technology. Let's try to do it with the PIEZOSURGERY. And then we did it, and we fell in love.
Which procedures are you using it for?
Well, as I said, it's a very fundamental part of our activity. So in probably all of the bone surgery is in the surgical field, is ready to work with. Is the most important tool or instrument for jaw and chin contouring, and then, as I said, is a complementary tool for other surgeries like forehead reconstruction or malar or whatever facial bone surgery.
After the adoption of PIEZOSURGEry, have you changed the way you do some surgical procedures?
Totally. I mean, we started from scratch because we were totally new using PIEZOSURGEry, but then we made an adaptation of our techniques, and nowadays we have described techniques based on the PIEZOSURGEry. So yes, we worked together with PIEZOSURGEry, and we have learned a lot. We're learning today even, and yes, we have adapted our techniques. Yeah.
Thinking about your patient, which are the main intraoperative and postoperative advantages?
Probably to me, the most important one is the predictability of the surgery. So we know exactly what are we offering to our patients and what are we going to have during the procedure. This is day and night. This has been a dramatic change. But then, as a very safe and very non-harmful technology, we can guarantee a better post-operative healing, less swelling. So in the whole process, it helps. It's not just during the procedure itself, but the whole intraoperative and post-operative staff is very helpful.
In your opinion, is there any disadvantage?
It's like a common and classic that people say that is very slow. Actually, it's not slow. It's a matter of knowing how to use it, knowing how to position the insert, knowing how to move your hand, and with the new medical and the flex devices, you can be as fast as with the traditional technology, but with all the advantages of the PIEZOSURGEry. So I would say that I cannot really find important disadvantages.
How long did you take to master the technology and fully understand how to use PIEZOSURGEry devices?
As I said, we are still learning, so it's part of the day by day. So we use every single day many different types of inserts for different types of procedure and surgeries. we have progressively learned how to use it, when to use every specific tip or the inset for which procedures, and since 2010, now we are in 19, it's almost 9 years learning. So it's not that it's an impossible learning curve, but you always are learning and doing things better thanks to piezosurgery.
Is there anything else you would like to add?
Sorry?
Is there anything you would like to add concerning the technology, the benefits as well?
Well, your company is always working in how to produce and how to present surgeons more powerful and faster devices, and this is something that is going to be good. The moment that the speed is a little bit better, it will be very good for everybody, surgeons, patients, and yourselves. Of course, we are working in new insets adapted to different specific anatomical areas of the lower jaw, but this is something that now we know that is working very well. So nothing very specific.
Thank you, doctor, for your time.
Very, very kind for your time.